You ever stop and wonder why we do things a certain way in nursing? Why that procedure or why that policy? Well, a lot of the time, the answer isn't in today's textbooks, it's actually buried in the past. So today, we're basically firing up the time machine to explore historical nursing research. It's a really cool method that helps us make sense of our present by digging into our history.
So here's our game plan. We're going to start with the absolute basics. Then we'll get into the blueprint for any good research study. From there, we'll zero in on the historical approach itself, look at the detective work it takes, and explore why it's so darn important for modern nursing. And of course, we'll wrap up by talking about the real-world challenges. Sound good? Let's dive in.
All right, first things first, before we can really get into a specific type of research, we've got to have a solid handle on what nursing research is at its very core.
This quote really nails it because it highlights two super important jobs. See, research isn't just about those big, flashy, headline-grabbing discoveries. It's also about double-checking and fine-tuning what we already think we know. It's all about building this rock-solid foundation of evidence so that nurses can provide the absolute best care for their patients.
So how do you actually build that evidence? Well, you can't just wing it. You need a plan, a blueprint. And in the world of research, we call that the research approach. Think of it like a game plan for the entire project. It's the high-level strategy that dictates exactly how a researcher is going to tackle their question. It tells them how they'll gather their information, how they'll make sense of it, and how they'll eventually draw their conclusions. Seriously, without a clear approach, a study can get lost really, really fast.
And it's not just one simple choice either. It's this whole framework of decisions, right? It covers everything from who you're going to study to the nitty-gritty of how you'll analyze the data. Every single piece of the puzzle has to fit together perfectly.
Okay, so these research approaches usually fall into three big buckets. You've got quantitative research, which is all about numbers, measurements, and stats. It's about measuring things. Then there's qualitative research, which is what we're talking about today. It explores experiences and meanings to give us a really deep, rich understanding. And, you guessed it, mixed methods just combines both.
And that brings us to our main event, the historical approach. The whole idea here is about looking backwards to find the insights that help us move forwards. It's built on this belief that to solve today's problems, we absolutely have to understand how we got here in the first place.
Now, this is super important. We are not just telling nostalgic stories about the good old days. This is a rigorous, systematic, and objective process. It's about finding evidence, putting it under a microscope, and then carefully piecing it all together to figure out what really happened and, more importantly, why it mattered.
Three things really make this approach unique. First, its focus is temporal. It only looks at stuff that's already happened. It's in the past. Second, unlike a lab experiment, the researcher can't change or control anything. They're basically an observer of what's already done. And third, and this is a big one, context is everything. You just can't understand an event without understanding the world it happened in.
So that brings us to the how. How do researchers actually find all this evidence? Well, honestly, it involves a ton of detective work, sifting through all the clues that the past has left behind. And those clues fall into two main categories. The distinction here is absolutely critical. Primary sources are the raw materials of history. They're the first-hand accounts from that time period. Secondary sources are a step removed. They're the books or articles that analyze and interpret all those primary sources.
So, what does a primary source actually look like? Well, it could be a nurse's personal diary from 100 years ago, or maybe the official minutes from an early nursing council meeting. It could be photographs, old artifacts, or even oral history interviews with people who actually lived through a particular event. These things give you a direct window into the past. Secondary sources, on the other hand, are things like textbooks or scholarly articles that review a topic. They are incredibly useful for giving you context and for understanding how other experts have interpreted events, but they aren't the direct evidence themselves. A really good historical researcher uses both. Okay, so why on earth would anyone go to all this trouble? Why does all this detective work matter for a busy nurse working today? Well, as it turns out, the impact is surprisingly direct and, frankly, profound.
You see, historical research can answer all sorts of questions. A biographical study could look at a key leader like Florence Nightingale to see how her vision shaped the profession. An institutional study might trace the entire history of a nursing organization. A policy study can show the forces that shaped our current healthcare laws. And a social history can show how big cultural changes, like gender roles, influence the whole profession.
And here is the real takeaway. Whether you're looking at a policy, a clinical practice, or a professional debate, understanding its history is like getting a map of the territory we're navigating right now. It lets us see not just the what, but the why.
So let's just break that down a bit. First, it gives us the context we need to make smarter decisions. Second, it helps build a really strong professional identity by connecting us to the struggles and achievements of the nurses who came before us. And third, and this might be the most critical point, it provides ethical guidance. It's like nursing's conscience, forcing us to learn from past mistakes to build a better future.
Just think about this for a second. The study of absolutely horrific past events, like the Tuskegee study, directly led to the modern rules of informed consent and patient protection that we rely on every single day. This isn't some abstract history lesson. It's about learning from the darkest moments to build a safer future. It has a direct, tangible impact on every single patient.
Now, it's not all easy, let's be real. Like any research method, the historical approach has its own unique set of challenges and limitations that we definitely need to be aware of.
Probably the biggest challenge is the data itself. A researcher can't just create new data, they have to work with whatever has survived over the years. Documents can be lost, they can be damaged, or they might be held in private archives that are almost impossible to access. It's also incredibly time-consuming. And finally, you always have the risk of researcher bias, where a person's own views can kind of color how they interpret the past. But even with all those challenges, this work is happening, and it's providing some incredibly valuable insights. Here are just a few real-world examples of how this approach is being applied, from understanding the institutional history of a nursing council to tracing the development of specialized fields like military nursing or midwifery. So we'll end with this question for you to mull over. What past events, decisions, or struggles, things you may not even be aware of, have shaped the way you practice your profession today? Because uncovering that invisible history, well, it might just change how you see the future.